wondered exactly how many animals suffer in laboratories each year? There are so many animals in labs, but records are not kept for all of them. The Animal Welfare Act requires labs to report the number of animals used in experiments. However, this does not cover mice, rats, or even birds. Because these animals are not covered by the Act, they remain to be unaccounted for. We can only guess as to how many animals actually die and suffer each year because of animal testing. We do know it is within the millions. Cages upon cages are stacked up in a plain room. Each cage contains an animal that will live there for the rest of his or her life. This could be days, and in some cases, it could even be years. Because of the isolation and the insanity, the animals pace round and round in circles each day. They are only released from their small confined cages when they will undergo a variety of painful tests. They are forced to have products pumped into their stomachs, rubbed on their bare skin, squirted in their eyes, and even inhaled. Every animal whose purpose in life is to be tested on will never experience the freedom and will never have a chance to be loved. Animal testing is extremely costly and time-consuming. It is unreliable, and there are many alternatives which are readily available. Many animal experimentations are not only horrible for the animals, they are unreliable. Animals have different biological systems than humans do, therefore the test can never be 100% accurate. 52% of the drugs marketed between 1976 and 1985 were found to be more dangerous to humans than previously indicated by animal studies. In 1989, a study was done to determine if fluoride tends to produce cancer. During a period of 2 years, daily doses of fluoride were given to 520 rats as well as 520 mice. Not a single mouse was affected by the fluoride. However, the rats experienced cancer of the mouth and bone. This study shows how test data differentiates from one species to another. Drugs like thalidomide, Zomax, and DES were all tested on animals and they were judged to be safe, but when humans used them, devastating results occurred. A cough medicine known as Oprane tested successfully on monkeys and other animals, yet took the lives of 61 people and caused severe reactions in thousands of others. In 1994 alone, more than 100,000 people were hospitalized, and they later died from toxic reactions to medications which were not predicted by animal tests. If we relied on animal tests, we would still believe that humans don't need vitamin C, that smoking doesn't cause lung cancer, alcohol doesn't cause liver damage, lemon juice is a deadly poison, and arsenic and hemlock are safe. More than half of the prescription drugs approved by the Food and Drug Administration between 1976 and 1985 were withdrawn from the market because of the serious side effects that they had on humans. The National Institute of Health in the United States is the world's largest funder of animal experimentation. It dispenses $7 billion tax dollars in grants annually, $5 billion of which go towards studies involving animals. In 1993, the Department of Defense spent about $180 million on experiments using 553,000 helpless animals. To do a test on a single mouse, the estimated cost is $250. To do a test on one rat, the cost is between $500 and $700. For larger rodents, it is well over $1,000 per animal, and for non-rodents, the cost can vary between $5,000 and $7,000 each. These prices do not include the bedding and the cleaning that must be provided and routinely done to keep these animals healthy. There are a variety of different ways we can test products without the use of animals, which are also less costly. In 1959, The Principles of Human Experimental Technique was published in London, defining the concept of animal testing alternatives as the 3 R's: refinement, reduction, and replacement. Most people tend to believe that experiments on animals are necessary for medicine and science to progress. This is not the case. The belief that we must experiment on animals is being challenged by a growing number of physicians and scientists who are utilizing many research methods that do not harm or kill any animals. For example, in vitro, research is conducted in an external controlled environment, such as in a test tube or a petri dish. Because most illnesses do their work at a microscopic level, these experiments are great for studying the course of human disease. iTex, for example, it was produced by the National Testing Corporation in Palm Springs, California. It is an in vitro procedure, and it measures eye irritancy. Before in vitro came about, the procedure used to measure eye irritancy was called the Dries eye irritancy test. The Dries test tests for toxicity in cosmetics and common household products. This test is most commonly performed on albino rabbits. These rabbits have large, sensitive eyes, and the structure of their tear ducts prevents tears from washing away any harmful chemicals which are placed in their eyes. This sometimes causes their eyes to swell and even bleed. Rather than making these animals suffer in so much pain, we can now depend on iTex. How it works. It is a vegetable protein from the jack bean, and it mimics the reaction of the cornea to the chemicals, and it gives you much more reliable results. Unfortunately, many companies still do not use this new in vitro method, and millions of rabbits still suffer annually. Another alternative test is known as SkinTex. This is another in vitro method as well. It measures skin irritancy. This test can be used in replacement of the Dries skin irritancy test. The Dries skin irritancy test is usually done on rabbits or guinea pigs. The substance in which is being tested is rubbed on the animal's shaved, bare skin, which is then covered with plastic sheeting so that the poor animal can't scratch it or lick the substance off for several hours. Then the skin of the animal is abraded by pressing adhesive tape and then quickly ripping it off. This process is repeated so that the many layers of skin are removed prior to testing. SkinTex, it uses pumpkin rind rather than the skin of the rabbits and the guinea pigs. The pumpkin rind mimics the reaction of the foreign substance on human skin. With the technological advances we have today, there really is no longer any need to test on helpless animals and make them suffer in so much pain and misery. In conclusion, Professor Charles Magel stated, "Ask the experimenters why they experiment on animals, and the answer is, because the animals are like us. Ask the experimenters why it is morally okay to experiment on animals, and the answer is, because they are not like us. Animal experimentation rests on a logical contradiction. In fact, 33 animals die in laboratories each year worldwide. Animals and humans are built differently. Because of this, animals don't suffer from diseases in the same way that we humans do. In fact, 90% of all results are discarded as they are irrelevant to humans. The testing of millions of innocent animals annually only to produce misleading or unnecessary results should be abolished. There are at least 450 different alternative ways to replace animal experimentation, which is a lot less costly and also more reliable." I'm done. Yay! We're going to have to do that again.